Health and wellness are more than a destination. They are a process and a journey of personal choice. Come hear from people out in the field, doing the work, bringing health and wellness to many. Welcome, everyone. Today, I have the pleasure of interviewing Dr. Autumn Frandsen. She is a naturopathic physician, and she works in two practices. Let me try to get this straight here. NIHA, National Integrative Health Associates, and also another one in Frederick, Maryland called Velise Total Health. So I'm delighted to have you here, Dr. Frandsen. Can you share a little bit about yourself professionally and what brought you to this point?
Sure. So when I was growing up, we didn't really go to traditional doctors very often. Honestly, without much of the medical interventions, we were pretty healthy and ate well. And when I decided to go to alternative medical school versus a conventional medical school, it was after I'd taken an economic botany class and we learned a little bit about medicinal herbs. And I got really interested in that. And I liked the idea of making the patient experience a little more warm and fuzzy than a hospital setting, and then also using things that took parts of the plants that helped to mitigate some of the side effects that the isolated medicines that were derived from these plants caused. So I kind of just fell into it. I was going to go to medical school to be a dermatologist and just pivoted in my last year of undergrad because I had just electives to take. And so I took some grad level botany classes and just got really interested in the herb aspect of everything.
I'm curious about how you got your own practice started then and how you got involved with NIA, because that's a pretty big clinic in Washington, D.C.
When I was doing my residency, I took some training with autonomic response testing with Dr. Klinghardt, and I got certified in that. And because I was on the list of practitioners, Dr. McClure in DC reached out to me actually and said, we need more practitioners that know this modality. And would you be interested in working? And I had just had my daughter not long before that. I was trying to stay home and spend some time with her, but I found myself working a couple days a week. And then I got, really busy and really passionate about what I was doing. And then slowly, phased in more days and picked up a couple of other modalities from the practice and just really liked the structure of having many different types of practitioners and many different schools of thought all coming together as one.
That's so wonderful. Tell me a little bit about what naturopathic medicine is exactly for those who don't know.
So naturopathic medicine has several philosophies that are really great, but I won't bore everyone with all of them. But one of the big ones is tole causum, which is treat the cause, which is not the symptom. Naturopathic medicine is more of a holistic philosophy. So instead of like, if you were to think of a house, instead of just calling a plumber or calling an electrician, for different aspects of the body, like the liver, or we look at it as one total person and how is everything that's working in the body affecting the well-being of the person. We use all kinds of things like acupuncture, homeopathy, some states use acupuncture. We use herbs. We use functional medicine. We use epigenetics. The list goes on. But naturopaths are usually on the cutting edge of, the latest research and always trying to think about the fact that we don't know anything really.
I love this because, as a nurse, I was in a traditional medical setting for many years, and that was missing. So this needs to change, and I'm so excited with your work. So one of the things, I met you because I had allergies, and there are so many people right now who have allergies. Can you tell us a little bit about, first of all, why people have allergies and why we have so many?
Yeah, it's a complex question, definitely. I think more recently, the allergies have exponentially grown, probably because of stress, because of poor nutritional availability, because of so a lot of people use antibiotics and they use antifungals and they use, pretty hard-hitting medicines when they have an infection, but they're not looking at why they're getting the infection in the first place, what's going on with the immune system. And then once you wipe out one line of defense, with antibiotics, like the microbiome, the gut health, then it can lead to inappropriate responses in the immune system in different areas. And then there's also, the concept of epigenetics where different things, like I guess I would say occupational toxicants or like environmental pollutants have grown because of the industrialization and the development of urban countries. So all those pollutants that we're inhaling aren't being filtered by anything but our lungs. And then once we have lung turnover and cellular turnover, there can be issues in the DNA methylation cycle. And that can turn on other types of genes that predispose people to have allergies. So when somebody has a mom or a dad with allergies, that's one piece to the puzzle. But if there are certain mechanisms in line, they may not display symptoms of allergies. But I will say it's more common in women, especially after pregnancy, because of the stress on the body that causes, and then how everything that we're filtering when the baby's inside, it's kind of trying to protect the fetus, so our immune system gets taxed. So there's a lot of reasons.
So, what are you finding? Like you mentioned a couple, and the epigenetic factors, the environment, the food, just to repeat a couple, stress causes a lot of issues epigenetically. So, and of course, for those who aren't, remember what epigenetics means, that means that those things, some of them are in our hands, they're coming from the outside. You mentioned the genetics, which can come from your parents. So, I know, for instance, my mother had severe allergies from her whole family. So, I definitely fit the genetic profile and I definitely fit it when I got older. So, but what do people like in general when they come to you? What do you find them allergic to?
I have seen so many interesting things. Nickel, um, many different types of foods. I mean, the top five food allergens would be corn, dairy, wheat, egg, and soy. Those are just statistically, the most. But I find that a lot of people react to bananas. Yeah. So, and those are pretty common fruits that, people eat every day. Just grab a banana and go.
You have the food.
And then you have environmental toxins like, heavy metals. And some people have heavy metal toxicity and some people have heavy metal allergies. And then some people have both. So that's a big one.
You can tell the difference with your testing.
Yes. And then there are, molds, grasses, pollens, um, weed, shrubs, trees. I mean, you name it out there. Um, I would say, I mean, some people react to the molds and the different bacteria that are on their skin and in their GI tract. It really just depends, where they're at in their epigenetic changes and, where they're at in their life. Some people will even react to water if there's certain things like chloramines in there. Um, and then I've had patients that react to tobacco, cannabis, alcohol, um, formaldehyde,
Where
general.
does formaldehyde come from? Because I've heard of that too.
So it's embalming fluid. That's what they use, for embalming people. But they also have it in like new carpet, new couches, furniture.
Is it in paint?
There are some in paint, yeah. There's more VOCs, in paint than there are formaldehyde, but um, it's pretty much everywhere.
That's really crazy. So I'm curious about this. Okay, so they're allergic to these chemicals, heavy metals, and then of course you have pollution. Like, are they ever allergic to what we put on food, like pesticides?
Yeah, people can react to that too. That's why at the very minimum, I'd say eat organic if you can. Not that that is fail safe, but and then there are theories about the integration of, certain pesticides into the genetic makeup of the crops.
Green GMOs.
Right. Some
Yeah.
people are actually allergic to those things, and some people just have an inundation of it, or toxicity.
So you have all of these things. I mean, there are so many, right? So you're just going to test them and you're going to find out what it is. But I'm curious, like when I know for me as like I'll give an example. When I met you originally, like that was like a long time ago, 12 years ago, and I first had these symptoms but I was really then allergic to molds more and some chemicals. And I remember finding the mold. I was unaware, and I found a black mold in my garden, but I didn't know. I wasn't really aware. Like sometimes we're just not aware. We're not paying attention until you found that I was allergic to mold. I didn't really look for it, you know? But then I had to come and have a gardener spray it. And then I got much better. That's so interesting. I'll never forget that because you found the mold and then I found it in my garden. And it was really black, like everything. And I just had never paid attention. So I just give that as an example because some people might even not know what they are allergic to until they go to a doctor like you and then they start to look in their life, right? Isn't that what you find?
Yeah, I mean, so there are different families of allergies too, or allergens. So for example, like latex. Some people know that they're allergic to latex, but they don't realize that, kiwi, avocado, a lot of different foods are in that same category.
That's
So,
crazy. I didn't know that when you until you just said that. That's so wild. So yeah, so we have a lot of things we might not know, and that's why it's good to see someone like you that we can figure this out, especially if we're really having symptoms. So what are the symptoms you see with allergies, the most common?
I would say if you're just looking at allergic rhinitis, that, fatigue, heavy, itchy, watery eyes, headaches, sore throat, just kind of feeling like you're in a haze, like brain fog, cognitive issues. But I also see a lot of joint pain.
And pollen we didn't mention, but like obviously those are natural things you can be allergic to, right? To pollen
Mhm.
and things in the
Yeah,
environment. So that's
absolutely.
so all these kind of symptoms, joint pain, that's interesting. I wouldn't have ever imagined, but I guess I can imagine the body is reacting everywhere, right? And
Mhm.
so when people are having allergies, they have inflammation, right? So it
Correct.
depends where that inflammation is that the allergen keeps
Agitating.
stimulating, yeah, agitating.
Yeah. So it's funny, like it's if you say you're allergic to pollens or molds, you wouldn't necessarily think, oh, my joint pain's connected to that. But because the body is in just a general state of inflammation, the inflammatory cells can congregate, anywhere. So it's not like the actual allergen travels to your knees and implants there, but it just kind of preys on the weaknesses in the body already.
Do you ever think it helps people to do like a cleaning of the body, like clean their liver? Would that help them?
Definitely.
Yeah.
I mean, I kind of use the analogy of a glass, so if you've got an empty glass and then you've got toxic exposure, then you've got stress, then you've got, genetic history, and you've got illness, a parasite or something like that. It just keeps filling and filling. And if you take care of one of them, it may not spill over. But it's when you neglect yourself and you don't, cleanse and eat well and take care, sleep and all the other things that you need to do, then the cup can spill over and then you get symptoms.
So let's say people are going to come to you. So they're going to come and they're going to make an appointment. And I know you see, like when I met you originally, we just saw you in person and you have machines and blah, blah, blah. And I want to go over that in a minute. But I know now since COVID, and I'd love you to address that, you also can see people all over the world online. So can you address that, Dr. Frandsen? Because I think that's so important.
Sure. Yeah. So with telemedicine, a person can mail me a cheek swab, and then I use the DNA on that cheek swab to do whole body electrodermal screening or autonomic response testing, which I can tell you the difference in
Yeah.
a minute. Um, we also, with electronic medical records and, all of the requisitions we can do online, we can send you kits and you can do it at home, or I can send you a requisition and you can go to a, pretty standard lab and get things done there. So with telemedicine, we can look at the body completely in totality, just like we would in person. Obviously, putting your hands on somebody or feeling someone's energy or, just kind of being close to them some people like that, but some people with the busy schedules that we have these days, prefer just let's sit in my living room and talk for an hour and then, I'll send you everything you need. So it's kind of neat because we can do it so many different ways with telemedicine.
You said to me originally this changed at COVID because you couldn't see the people. So you
Mhm.
developed this telemedicine. It started and that's really interesting how COVID kind of gave us certain abilities too. Like it wasn't all bad. It helped medicine kind of evolve quicker, I think, right?
And suicide rates went down, and there were some good things that happened. Yeah, I mean, I think that the fact that we're allowed now to do more and reach more people is very important, especially with the low numbers of naturopaths and holistic physicians in the country and in the world. So, that now that we are actually permitted to reach these people, I think, the awareness is growing.
So autonomic response testing, what is that? And how does that differ from electrodermal screening?
So that's the method that I learned at the Clean Heart Academy. That one, autonomic response testing is more like advanced muscle testing. So you use the body's energy fields to figure out where their imbalances are in their body, different organ systems.
Like kinesiology?
Like that, yeah. It's a little bit more in depth, but it's a version of that. And it can you use different crystalline structures that you use to enhance the energetic output of the body. And in scientific words, it's kind of hard to explain. I think there's a lot we don't know how to, pinpoint that our bodies are in tune with. So you'll have a surrogate that actually I would use their arm to tell me whether or not the patient's biofield is getting weak. And then we can place things in these crystals that will enhance the signal to the body, and it will tell you whether or not the body's reacting.
To a bacteria, to a virus,
Whether your hormone levels are up or down.
an electrodermal screening?
That's operating under the idea of biomeridians, so Chinese meridians of the body. And that can do the same thing. We can use whatever's imprinted in the program to check against the body's biofield, or we can introduce things into like a signal enhancer that will also transfer onto the person to see if they react to it. So I prefer the electrodermal screening because it's easier. The patient just sits there.
Or you put the cells
Or
there.
you put the swab, the cheek swab, which is, the surrogate for the patient. And then we can test, so many different things quickly. And it doesn't introduce anything to the patients. A lot of patients, when we do autonomic response testing, they'll feel great or they'll feel horrible afterward, because introducing things that cause their issue can sometimes fatigue them. But with the cheek swab and doing it, telehealth, we don't have that effect.
So I just want to say, like, diseases obviously are interesting as they're all different causes, right? You go for the cause. So if I know at your clinic, you do particularly allergies, but let's say you found something worrisome and you thought someone might even have cancer. Their system was so low. Would you see a low reading of an immune system so low that you would refer that person, or does it not show up like that?
Well, so I usually combine like lab testing with these methods too. And if I see, a critical white blood cell count, or any of the other biomarkers like a low iron or something that's very concerning, then I will refer out.
Okay.
I do cancer co-management, so I've had patients with stage 1 to stage 4 breast cancer that I've exclusively managed, and they're, doing well. But I like to make sure, an oncologist sees them at least once.
Yeah. So let's go back to allergies because that's really your expertise too. That's what you've really pioneered in some way. So you have a way you treat. I would love you to go over the desensitization process for the people. What is that?
So it's kind of similar to allergy shots that you would get at traditional office. The testing, is obviously not the skin prick testing that you would get at a traditional office, but it involves oral immunotherapy. So you take a very low level of the thing that they're reacting to and you dilute it to a point where it's really not even a crude substance anymore. It's just more of like an energetic level at first. So you would dilute it, and then they would take the drop once a week. So week 1, you would start at 1 drop, and then you'd wait, like say you do it on Monday. The next Monday, you do 2 drops, and you titrate up that way till you get to 5 drops, and 5 would be your maintenance dose. So then you have a 10-week round of these things. And then the next time you get a new round, it is diluted a little bit less. So you're able to, over time, tolerate more and more of this substance that you once couldn't. But it's at a level like where an allergist, that's doing the injections, it might really make the patient sick, or it may do nothing. These are more tailored towards the patient and what level they're at.
So how long does this process usually take?
So I had the nanny that I used to have for my son. She was allergic to dogs, and she came and day one she was a mess. And so I made her some allergy drops for dog, and within a week she was able to sit with him and actually pet
Wow.
him. So and then that's an extreme example, not
I was
every.
gonna say, that's wild.
Um, and that's happened before. Same with a member of my family with cats. My sister has cats, and so we did that. And the animal thing, they respond really quickly. Um, on average, I would say a year to 2 years. So
Okay.
you get relief pretty quickly, but the actual like for it to hold, you go through the whole program, it's about 2 years.
Let's talk about gluten just 1 minute because what we're eating, I just want to address that. We're eating this modern grain, which is not actually very healthy. And you see, obviously, a lot of people not able to handle that. Can you
Mhm.
talk about that for a minute? Because that seems to be a big issue.
Yeah, so I think that the prevalence of wheat and gluten in everything is one of the big problems. There's theories about glyphosate being on the crops and getting, genetically modifying what the actual plant's supposed to be. And then, there's the glyphosate finishing at the end where people will spray it at the end, which doesn't really have time to change the genetic makeup, but it, will agitate the immune system. But there's disparity there, is that accurate? Is that not? I think more than likely there is some, truth to that. But I think it's just a lot of people already have leaky gut or they have some permeability in their gut lining and their immune system's already agitated. So you keep introducing the same thing over and over again when there's no tight junctions in the cells of the gut. Um, it's going to eventually be looked at as an allergen and an irritant, and the immune system will attack it.
So then you just can't handle it. When you eat it, you feel bad. You
Yeah,
get
plus on top of that, a lot of the things that contain wheat also contain sugar and food
Yeah,
coloring.
very addictive. Oh my goodness. Oh, thank you, Dr. Frandsen. I just want to end this, and I really am grateful for your time today with medicine is evolving and hopefully more and more people. You say there's not enough of these kind of doctors and practitioners. And I know like I train health coaches and they become a part, especially if they're trained holistically, of helping you with your work. So I'm just would love you to address where you think you're going to be where medicine should be, where it should start to go to really help people be healthier and happier, actually.
So I am noticing that in the mainstream medical community, there are more conferences on the microbiome, and there's more awareness of the fact that, different regions of the body all have their own specific bacterial content that protects people, though, orally and with the GI. And in naturopathic medicine, we really look at the gut as the crux of your health. 90% of your serotonin is produced there, and
Which is
that's your happy
happy.
hormone. Yeah. And I think there's a huge connection between the microbiome and just general well-being. And mainstream med, so not to digress, but mainstream medicine is finally starting to like say that there is validity there and actually holding their own conferences. And so I think as naturopaths, if we can continue to just keep doing the research and keep ignoring the haters and just
Yeah.
keep staying the course, then eventually with the science, the money that the mainstream medical community has and the studies they put out, we can keep affecting change. And if we can all work in tandem, I think that would be great. Um, I think that money is unfortunately a big obstacle to anything. And, that we just don't have the legislative backing to get the licensure and the awareness out that, we need to. So in a sense, it's great that mainstream medical is finally taking the ideas that we've had for 25 years, and making them, more of a mainstream concept. But I think that in the hospitals, if we could start to introduce gentler interventions, versus antibiotics and IV steroids and things like that, we would be better off. And I know in Germany and some of the states in the US, they actually employ naturopaths. And I have one of my professors was a naturopathic cardiologist that had hospital privileges, and he would give a homeopathic remedy versus like propanolol or something like that, and the patient would feel better. and they
Yeah.
didn't have the need for more supplements to replete what those other things are depleting. Um, so I just think, spreading awareness and making sure that we are all in it for the greater good and not, trying to get recognized for something that's really just almost a basic human right, for
Yes.
health. I think that would really help.
I also, in my own work, see a lot more, especially in Europe, of these clinics starting with
Mhm.
people like you at the helm. So maybe you have a naturopathic doctor, a functional medicine doctor, you have health coaches, you have nutritionalists, you have, let's say, certain therapies like osteopathy or acupuncture. You have other therapies in that you offer there. And
Yeah,
I think that's kind of what I'm seeing, the trend to really look at the person holistically, maybe even hypnosis and other things for people at the, like I always think, I don't know how you feel about this, but the fact that we had mental health separate in a hospital never
Mhm.
made sense to me because look what you just said, the serotonin's made in the gut, and here we are treating mentally health patients like that's separate or something when it doesn't have to be, and it
Right.
affects the whole body. So I think a real look at things differently would help our whole profession. But I'm very grateful. Thank you so much for your
Of course.
time.
Thanks for
Yeah,
having me.
you're wonderful. Thank you, Dr. Francis.